that, hey, if we can decrease the use of this by X%, I feel like we're moving in the right direction. Your decreased need for that is indicating and showing that you're making some biomechanical changes that are decreasing the activation of some of those muscles.
That's great.
So it's cool to use that as a measuring stick.
Welcome to the Dr. JJ Thomas Podcast.
Hey, everybody. Welcome to the Dr. JJ Thomas Podcast. I'm JJ Thomas. So happy to have you here again on our show. I have a special treat with you, a very good friend and another brilliant mind. Before we get started with introducing my friend Joe, I just want to say thanks to all of you for subscribing and listening and being loyal listeners. I just realized recently that we've been doing this a year now, and I have to say it's been one of the most rewarding things in my entire career. Just the interaction with all of you, the feedback, hearing of your successes with your patients, with your businesses. It's truly been a pleasure. So thanks for believing in me, and thanks for continuing to listen, and hit that subscribe button if you haven't already. So let's introduce my friend Joe. Joe Dawson. Joe and I go way back to when we worked in the insurance-based world together. And Joe joined our crew at Primal Physical Therapy a little over a year ago.
Yep.
And Joe, part of the reason we brought Joe on was not just because he's an intelligent mind, he's a wonderful heart and soul, he really cares about the patients, all the things we look for in all of our therapists, but in addition, he had a niche. And as you guys know, we talk all the time about if you want to make it in the cash-based world, it really does help to have a niche. And Joe's niche is the evaluation, treatment, and management of TMJ, Temporomandibular Joint Dysfunction, or TMD. So, Joe, thanks for coming.
Thanks so much for having me, JJ.
Let's start by just hearing a little bit about your journey into how you found your niche. I guess a little bit about background first on you and physical therapy in general, and then if you could elaborate on that into how you found your niche in TMD.
Sure. So, started off in PT a little over 20 years ago and worked in a couple different settings and landed at a hospital, an outpatient clinic in a hospital, which is kind of a unique setting. And during that time, I was treating everything under the sun. I was a hungry therapist that wanted to learn and treat everything from amputees to post-op ACLs, and was treating an older physician within the hospital, the late Dr. Ed Granite. And Dr. Granite had done a very interesting procedure on a patient who had cancer in his mandible. And while I was treating him for his arthritic hip, he said, Joe, I just removed the mandible and I need to have physical therapy done. This man can't open his jaw.
Wow.
Can you help him? And as a young, hungry therapist, you say yes to a physician when they ask if you can help them.
A door opens. I tell this to my kids. A door opens, you walk through it.
You better believe it.
Yeah.
So that's what I did.
Wow.
And I researched. It really provided a catalyst to me as a hungry therapist to learn more about this TMJ that we had gotten some background on in school, but I didn't really feel completely comfortable jumping into this patient that had a piece of their mandible removed. And
right.
So I jumped in head first and learned quite a bit about TMJ through a number of avenues, taking some courses, looking back at my old textbooks, and found this passion for helping this gentleman who couldn't speak, couldn't eat.
Wow.
Was a Spanish-speaking patient, so couldn't communicate with me, which further complicated things. But it was obviously an incredible learning experience for me, and it really started my journey into the world of TMJ and TMD, and how do I help these patients that are lacking such fundamental life skills.
Yeah, for patients listening, you're going to hear us interchange TMJ, which stands for temporomandibular joint, and TMD, which stands for temporomandibular dysfunction. So as therapists, there are sometimes we're talking about the TMJ as a joint, and sometimes we'll say TMD in the sense of how the management of the TMJ through temporomandibular dysfunction, just as a side note. But so framework questions, all these questions just came to me. Sure. About when was this? Like how long ago was this?
So this patient, we're talking, we're going back 19 years.
That's awesome.
Yeah.
Yeah, and
so
it just ignited a fire in you. Like, wow, this was really cool. And tell me about that. Like, it sounded to me as you were talking about that there, everything we do as physical therapists, most PTs, I think we do this because we enjoy the reward of helping people do things that they can't do otherwise. Like we say on our website, like we are proud to be part of your journey to help you do the things you love faster, right? So what is about treating this gentleman in particular that was so special?
He, like so many other TMD sufferers didn't have a lot of places to turn.
Yeah.
So your post-op ACL athlete, love them, but people are thirsty to treat those patients. There's a huge desire to treat that clientele. And what I found pretty quickly, Dr. Granite was asking me, because I was a PT in front of him, and I think he had already experienced the lack of care and outlets for these patients. So it's, first off, incredibly rewarding to treat an underserved population of people, which really helped me find my niche. I had all of these people all of a sudden starting to come to me because they had heard this person was effectively treated for their dysfunction.
Right.
But also just fundamentally, these patients lack, like I was mentioning, the ability to open their mouth or close their mouth. So they are having a hard time talking at work, talking with family, trying to sleep, trying to eat, some of the most basic life functions.
Yeah.
And when you can restore something like that on that level, that person has an appreciation for your profession and the skills and the treatment that you provide unparalleled with almost anything else.
Yeah, and it's so rewarding, right? That's so good.
It's why we wake up and do what we do, right? To help somebody get back to whatever function that is, whether it's playing tennis or walking down the stairs or eating your lunch.
Yeah. And it's funny because that just reminded me of another thing that I often, when therapists are asking me like how they can choose a niche, I'm like, oftentimes the niche chooses you. Like you think you're that happened to me with dry needling. Like truthfully, I sought out dry needling because I had a patient that had seen, I thought, everybody else and wasn't getting better. And I was looking for a way to help him. And that's how I found dry needling. But it really still chose me, just as it sounds like TMD chose you.
Yeah, absolutely.
Cool.
I mean, and the relationship that I developed with Dr. Granite after that and the other physicians that he ended up introducing me to and how that kind of played out the next 7-8 years of my career was really incredibly formative and still is now. I mean, with the way I interact with dentists now and the way I can interact with TMJ patients, you know, it was just incredibly formative for me.
So tell me what that looks like. So because I'm putting myself in the new therapist's shoes that's listening to this podcast and they're trying to figure out, you know, how they're going to know when their niche chooses them. So you found this passion, and then what were the next steps? What did you do from there to cultivate or curate this skill of yours, this skill set?
Yeah. So first was just having a fundamental understanding of the anatomy.
Yeah.
Like anything else, having a really good, making sure you have the fundamentals, the basics of the joint. Mm-hmm. And then working off of that and doing some osteopathic type education was what I was really into early on in my career. So taking some coursework through the Institute of Physical Art, but basically exhausting my options from an educational standpoint with these patients.
Right, like seeking out right, that's what I imagined, seeking out all the sources of continuing education you can to support the foundational anatomy that you knew on your own.
And additionally, seeking out Institute of Clinical Excellence. I thought they were an incredible outlet for some extra foundational background information. And then learning through your patients is a powerful tool.
Yeah.
Being able to see, I worked on this joint in this way, and this was the response I got, that retest, and really diving into getting a sense for what worked and what didn't. Sometimes not as efficiently I would have liked to early on, but now it's much more of a well-oiled machine as far as that goes.
So I'm glad you brought that up, because I know in the year's time that I've been working with you, I've seen your clinical success rates accelerate even like astronomically. I mean, skyrocket. Yeah. And I mean, you were always an excellent clinician, but I definitely have seen a sharp uptick in your ability to get patients better faster. And so, you know, tell me about that. Like, is that... I tend to think that partly has to do with the model, like switching from the insurance-based world to the cash-based practice model, where you now have time to test, retest, and really develop your own clinical patterning. But I'd love to hear your perspective on if you think that was an influencer, or were there other influencers?
That's a huge influence. The move in environment, and certainly my former position, I was a manager and had a lot of hats to wear, but just the business model that we had was fast-paced and tended to, you got something in your target and you went after it, versus the environment that we treat in and that I treat in now, and get a chance to really evaluate the body as a system, look at the person from head to toe, get a chance to explain to them why I'm looking at their back.
Yeah.
additionally, these patients are coming in as TMJ patients. They didn't even know that physical therapy was an option for them.
Right.
So explaining why they're even there. Why
Yes.
did your dentist or your doctor even think to send you to me?
Yeah.
This isn't your knee. This isn't your shoulder. This is your jaw. We're going to be putting our hands in your mouth possibly.
Yeah.
This is a different experience. And so I just find that was, also something that was super interesting and something that I kind of had to wrap my head around as I started to work with this clientele.
That so how do, as you bring up a good point, like the TMJ is the temporomandibular joint is just another joint, right?
Absolutely.
Like it is and it isn't. I mean, sure, you're going to be sticking your fingers in their mouth, but I would love if you could talk to me about your perspective on the similarities and differences between treating, say, a TMJ and treating maybe a knee.
Sure. So a lot of similarities, as you alluded to. You were still dealing with muscles, joints, nerves, blood supply, and a brain. So, this person is apt to stresses and all the other things that come along with it. So lots of similarities. I'm still looking at the body as a whole. A lot of times I analogize, or it's an analogy of the foot to the TMJ, where the kinetic chain has such a profound effect on it. So the foot, right, what happens at the hip and the knee and the low back has a big time effect on what happens at the foot. Well, it's the same thing for the jaw. All of the things that happen on this chain up to that jaw have a profound effect. So that is very similar in that we need to look at the body as a whole. But differentially, we're dealing with breathing. We're dealing with possibly sticking our fingers in somebody's mouth and working through the inside of their cheek, which as a PT is an incredible feeling, being able to work on the muscle from the inside and the outside of the muscle. So many muscles, when we're palpating, we can't get that type of a feel on the muscle. And that's pretty incredible.
And also an honor. I will say, like, there are certain things we do as PTs that I know none of us in our facility, and I'm sure many of you, don't take lightly. So, like, for patients that are listening, recognize that we are honored when you trust us, you entrust your body with us to do something. It could be potentially construed as invasive to stick your fingers in someone's mouth, but it's a necessary intervention in order to get the results we want. But we don't take that lightly.
Right.
Yeah.
And I mean, that's, as you said, can feel intrusive at first, but I think if you're working and you have the experience of working with those patients, A, you see it as an honor that you would allow me to even approach you. And B, I think as a professional, I think you can explain the basis for why you're doing it. And if you're receiving treatment for TMD and they're not going inside your mouth, you may want to be concerned about the care that you're getting.
That's
so
right.
Yeah, I think it's an incredibly important point, and obviously a big difference when you're treating TMD. But otherwise, when you think about similarities and things, head position, thoracic treatment, how they breathe, tongue function. Tongue function is probably a difference, we'll say, because I don't know how often we're looking at the tongue with any other joints in the body. But that's also a very interesting kind of aspect of treating TMD.
Yeah, that's great. And what about, so you mentioned a lot of things that seem very postural to me. And so could you give a guesstimate of how many patients you treat with TMD that you would say have a postural component?
I would say 85% have a postural component.
Yeah, I would have guessed that.
And the other 15%, we just haven't noticed the postural component yet, probably. But yeah, I think that's a huge part of it. And so what I talk with a lot of my patients about when it comes to posture is thinking, having a clear understanding of how the TMJ changes based on my head position and the most important things we do is talk and eat in these seated postures.
Yeah.
And so thinking about the open versus closed pack positioning of the jaw and making sure that the jaw is put in a position to win, just like the knee or any other joint, is critical. So oftentimes I'll joke with my patients that imagine you're eating dinner with the Queen of England, and you have to really be hyper aware of your posture as you're eating for those irritable TMJ joints. That's oftentimes what I'll do is I'll kind of give them a thought to kind of have in their head. So as they go to eat or they go to talk on the phone at work, that they're envisioning this posture that will help their jaw perform at its best.
That's great.
Yeah. So posture is a huge component of that, which then leads into breathing and any number of other topics.
And that's, again, why we have to treat the body as a system, right? Like that is, for those of you, Joe's drank the Kool-Aid for sure at Primal headquarters and through Primal University. And yeah, I mean, if we're just treating the jaw itself, we're really just potentially treating the symptom and not really addressing the underlying causes. So patients, clinicians listening, make sure that you're working with someone that can address those things. What about, on that same note, you and I have had conversations before about the use of mouth guards. Mm-hmm. And I'd love you to give the audience a little bit of your perspective on their use, and how you prefer they be utilized within a plan of care. And I know it's going to depend, but give me the best case.
Yeah. So I've learned over the years, just by interacting with different specialists, there's a wide array of night guards. I think first and foremost, when we talk about night guards, we have to think about what kind of symptoms does the patient wake up with, and what do they really need? Do we just need to protect the teeth? Are we trying to keep this clencher, this grinder, from cracking their molars? Or do we need to actually do something more significant with that night guard? Is there something we need to do for the arthritic joint that requires some decompression? There's some incredible things that some of these specialist dentists out there can do with these decompression braces to help with bone marrow and helping the end of the mandible kind of regenerate bone to make it easier for the disc to be recaptured. Some really interesting studies out there. So yes, there are night guards. There are custom night guards that great dentists out there. If you have a good relationship with a dentist, understanding how they approach that with their custom night guards is important. But also for those patients that just need their teeth protected, they may do better with just an over-the-counter. And that's really important, to have those good relationships with your dentist and your referral sources so that everyone's on the same page as far as what's going to be best for that patient. Is it an over-the-counter? Is it something that they need custom because of their bite and the symptoms that they're dealing with? Or do they need something decompression-wise? And those decompression orthoses are interesting because oftentimes they wear it during the day as well. So that's a whole different ball of wax, but I think very interesting nonetheless.
So I have two questions off of that. One is on the treatment side of that. Like, I know for myself, when I have patients who wear foot orthotics, for instance, my goals with those patients, if possible, is to eventually wean them out of those. And so how do you handle a prescription of a mouth guard? Definitely, as with a foot orthosis, there are times where it's absolutely necessary at that phase they're in. But if I can build and strengthen their arch and the rest of their body in a way that gets that kinetic chain back in line, and they can support their arch on their own, then that's going to be my end goal. And so how does that work with the treatment you do with your patients with TMJ and TMD and mouth guards?
My hope is always to decrease the use of any brace or orthoses over time. For the night guards specifically, not so much the decompression, but just specifically the night guards, my hope is to bring them down off of that, whether that's with using exercises to kind of set them up to decrease the activation of the masseter, but ultimately to move them away from it over time. And I almost use that as a goal, that, hey, if we can decrease the use of this by X%, I feel like we're moving in the right direction. Your decreased need for that is indicating and showing that you're making some biomechanical changes that are decreasing the activation of some of those muscles.
That's great.
So it's cool to use that as a measuring stick.
Yeah, because you and I are talking about this because we're very comfortable with it. But for patients listening, TMD is actually an overuse disorder. It's if you think of most, like as I said, TMD and other dysfunctions in the body have a lot of similarities, right? And so TMD, a lot of times the correct me if I'm wrong, but the jaw muscles get overused because you're clenching so much, right? It's a compensation pattern. And so I believe what Joe's saying is that when we can fix the alignment in the posture and in the structure all the way leading up to the TMJ, then those muscles will start to relax a little bit and not compensate as much.
Yeah, and even in the last couple of years, working with some of these specialists and looking at breathing, a lot of grinding, and the genesis for some of their grinding is them actually trying to open their lower airway at night. And so they're grinding their teeth back and forth, trying to open their lower airway, because we as humans tend to be poor utilizers of our upper airway, which is through the nose. And so if we're talking lower and upper airway through the nose, lower through the mouth, when we breathe at night, we tend to be snoring and blocking our upper airway and breathing through our mouth, which just drives grinding even worse.
Yeah.
So there's been some pretty profound changes in how we address some of this stuff at night to decrease some of that grinding just by helping with some of the airway stuff as well.
That's great.
And so if you have a practitioner that speaks your language, that wants to refer you a patient that's doing some of this stuff, watching how some of those things change by helping their breathing patterns can be pretty powerful.
And that leads me to my next point that I was going to make is that clinicians who are considering a specialty in the TMD, I think it's very beneficial. What I've seen you do in your own practice is the relationships you've built with doctors that you trust what they're doing. Because for me, that's always been one of the scariest things with any, referring a patient to any doctor is knowing that they're going to someone that is going to support their goals in a way that we are in line with, right?
Mm-hmm.
So I think it's great the community you've built of trustworthy physicians, they're all different types of physicians,
Sure.
right? In order to support your patients.
Yeah.
So you can actually help them direct who to go to.
Big time. And
Yeah.
I think that goes across a lot of different aspects of physical therapy and medicine in general, that if I'm referring you to someone, that person becomes an extension of my own practice.
That's right.
And vice versa.
Mm-hmm.
And so if somebody's referring a patient to me, I take that obviously as an honor, but it's also an extension of their practice.
Yeah.
And so we should be speaking the same language. That patient should be hearing similar messages from those physicians and us. And I think that makes the care collaborative
Mm-hmm.
in its very nature, and B, the patient gets way more out of it.
Yes. And the patient gets way more out of it because your goals are in line.
Yeah.
And as a profession, as you're building your practice or continuing to build your practice, I'm speaking to Joe, but I'm really speaking to all of you. As you're building your practices, as you're developing these professional relationships with doctors and physicians that you trust and you're in line with their same goals, you're feeding your own ability to serve your patients better, which is going to come back to everyone tenfold.
Absolutely.
Yeah, that's
Absolutely.
awesome. Through the years, I want to end. We're going to have to wrap up now. We're getting to the end of our time, but through the years, as you've developed your practice and you've developed this niche and this relationship with doctors and patients, is there any particular case that stands out to you that kind of supports, again, going back to, I think most niches are formed because you have this burning passion inside to do something helpful for other people. So is there any patient scenario that stands out that you could share with us that comes to mind when you think of patients that you've been happy to help through the years?
So I'll say there's a couple.
Yeah.
The first one was the gentleman that I mentioned early on in our conversation, was Spanish speaking, unfortunately had some cancer in the bone. Helping that man and seeing the look in his eyes, because he couldn't say very many words, but when you help somebody, you double, triple the amount that they can open their mouth.
Yeah.
The look in his eyes said everything
says it all.
I needed to see.
Yeah, it's amazing.
But since then, such a variability in the patients that I've seen opera singers who were going to get their masters that couldn't open their jaw more than 20 millimeters. And
Wow.
to think about an opera singer whose livelihood was to sing,
Yeah.
and to have that very specialized breathing technique helping her and being able to reestablish her mechanics with breathing and with singing was incredibly, profoundly enriching for me.
Yeah.
And learning. Some of our jiu-jitsu guys that are working their way, talk about opera singing versus jiu-jitsu,
Yeah.
trying to get out of a headlock. This is what his biggest passion in his life. Comes in with an emergently disrupted disc that was not relocating on its own, and he was having a big time issue with opening and closing. So when I think about this, I think about how fundamental opening your mouth and closing your mouth and being able to talk and eat and avoid a headlock or
Yeah.
or sing, how fundamental and how viscerally important these activities are to these people, and being able to affect that in some way, shape, or form is incredibly rewarding as a PT.
It's very cool.
Yeah.
That was cool. That case Joe just talked about just happened recently.
Yeah.
And in our meetings, in our staff meetings, we always share like one personal, one professional win. And that was one Joe shared with us. I'm really glad he did, because it's true that energy is contagious. Like you could see on Joe's, I wasn't there when he treated our jiu-jitsu friend. But it translated into Joe's energy and face. Like Joe's excitement sharing the story, that was, Doc sent him over pretty emergently, right?
Oh,
like
yeah.
the dentist couldn't act. He got the dentist couldn't help him. So they called Joe, like, Joe, help us out. We don't know what to do.
Yeah.
And
in that vein, getting his cervical and thoracic spine to do what it needed to do without getting too technical was allowed him to be able to close and really restore some centric rotation in his TMJ, which really was what he needed.
Which also brings us back to the point, like the body is a system. Right. And you can be, and even a TMJ specialist, a really good one, is going to still bring it back to the rest of the kinetic chain.
Absolutely.
And so thank you, Joe.
Yep.
That's a perfect line to end on. That's reinforcement to everybody listening that, like, truly, if you want to be an expert in the field, find a niche, but also don't forget to treat and train the body like a system. We happen to have some great Con Ed courses. I can't help but plug it. We have some great Con Ed courses. We don't have TMJ and specific ones yet, but we have great courses to help you treat and train the body like a system. So check us out, Primal University. It's primalhq.com. And as I said in the beginning, if you haven't subscribed already, hit that subscribe button, because we have a whole slew of other great content coming up this year. This calendar's getting booked out. And for patients listening, if any of those symptoms rung a bell for you, make sure that you check out Joe Dawson. What is your Instagram again?
Joey DPT.
Joey DPT on Instagram, or we can help you find him anytime you need it.
Absolutely.
Joe,
honor and a pleasure.
You're the best.
Thanks,
I'll see you in the office later today. And for the rest of you, don't hesitate to leave a comment or reach out anytime you have questions. I'll look forward to next time.